sexual maturation process, which starts in young girls as early, it can start in young girls as early as the age of 8. And that's why we are letting moms know that when you see your daughter developing breast tissue, know that the sexual hormonal process has begun. Menses will typically start within the next 1 to 2 years. And although it can be a difficult time for the mom to embrace the concept that her daughter is starting to mature, it's a wonderful opportunity where you get to bond with your daughter and discuss topics because she needs to hear it from you, better from you than from a porn site or from a girlfriend who may or may not have the correct information. So let's use this as a time to celebrate that your child is developing into womanhood, and you can use and guide her. You can use the information that's being provided here, and you can guide her into a better understanding and ultimately a greater appreciation for her body and the wonderful things her body is capable of doing. It's also a wonderful opportunity for some basic information to be imparted. And there are 4 things. One is just at this point, she needs to understand basic hygiene. There is a space between the outer lips and the inner lips, which needs to be clean. You don't necessarily need to put anything up into the vagina, but on the outside, the skin on the outside, between the 2 lips, outer lips and inner lips, there's a space that needs to be clean. She needs to know how to do that. She needs to be able to recognize and know her anatomy. You can do this by either showing her a picture from a book or in the privacy of your home, getting a mirror, helping her to see and identify. It reinforces for your daughter that there's nothing ugly or abnormal or obscene about her body. You can also reinforce for your daughter at this time that no one gets to touch this area of her body without her permission. And if she feels that someone is transgressing, going too far, making her uncomfortable, that it is her right to speak up and that you're available for her. So knowing basic anatomy, understanding how to take care of herself with basic hygiene. And then if there is a problem, how do you identify the problem? How do you talk about this with a healthcare provider? You start by tracking and documenting the symptoms. Abnormal periods can usually present in several ways. Either they're very painful, and we call painful periods dysmenorrhea, or periods can be abnormal because of too much bleeding, or because the periods are irregular and spaced out. And one of the ways that you can document this, and this is my recommendation to any and all women who are menstruating, use a menstrual calendar. Have your daughter start to track. There are apps which can be downloaded onto her phone for free. With the menstrual calendars, you can also document if there's pain, if there's nausea, if there are any other associated symptoms, when they started, how long they lasted, the intensity. So having a period tracker is wonderful. Wonderful. Most of us have a smartphone. Use it, let your daughter use it. Let her know that this can be her personal tracking, and that if things appear to be abnormal, when she goes to the OBGYN, she can show this documentation, and that will be very helpful. It will help us to be able to differentiate which is what is just a normal maturation process versus something that is pathologic. It will help us to know whether your daughter may have a bleeding disorder, which is why she's bleeding so heavily, or whether there is no concern for the amount of bleeding that she's doing, that it's not excessive. It helps to differentiate that, in addition to doing additional labs or testing as may be warranted. For the mother of the child, it's sometimes an uncomfortable moment because we have difficulty accepting the fact that our child, our baby, is maturing. But if we don't use this opportunity to speak with her, she'll be without the guidance that she needs. Use this, see this as a celebration, use it as an opportunity, with the goal being your daughters will be informed, educated, secure in their body, and proud of who they are and what they're capable of doing. Until next time, this is Dr. Rahman. Take care.